We're ready now to do a face bow transfer on Bruce. This will be on the located hinge axis. As you recall, when I showed you these slides earlier today, I showed you how to do an arbitrary mounting, just an ear bow mounting, or what they call an anatomical face bow. This is a true hinge axis mounting that we're going to do now. We start out with the bite fork, and Olivia has already put the compound on the bite fork and has tempered it in the hot water. So we're going to, you can tip your head back just a little bit, we put this over the teeth and hold the stem to the right, straight ahead, slowly, slowly close up, just bite your teeth slowly in a retruded position. Open please. And we like to catch anterior teeth, right and left molars. Now, I almost missed the molar here on the right side, but I got just enough of it that I think we can do it. Maybe we should reposition that again, so if you'd cut the video just a little bit, we'll go back and heat that again and try it again. Alright, now we've reheated the compound, and keep your head down, Bruce, we can see this a little bit. There's a midline mark right here on the face bow, and we put his incisors right there, and now bite up slowly on your molars, bite into it, just press right into it a little bit, open please, and there we've gotten an index of the teeth. Alright, we have to hold it up with the lower teeth, so there should be indentations of the lower molars back here, and the lower incisors on the bottom half of it to hold it against the uppers. Now we dip it in the ice water. We have 2 bowls of water, remember. One has warm water in it, the other has ice water. The ice water will freeze it very quickly, and we can go back and try it with the patient again, like this. I'll bite into it, like that. Okay, we then reline it. And what we do is to take our sharp scalpel and cut back here until just we have the deepest indentations of the teeth, and we're going to put some co-nogenol. You could use any bite registration paste you want and put it in the 3 areas here. You do not have to put it on the mandibular side, just the maxillary side. So I'm going to dry it with a paper towel first, like this, and then Olivia will hand it to me with a knife, and we'll just pretend that we're shaving this back. Here, maybe we could, you could hold a paper towel for me here a little bit, and we'll just cut this back. Ordinarily, we do this over a trash can or something where we could, or in the sink someplace, but you can't see it here, so we'll just trim it back here. And I made sure the indentations were not very deep, and we don't have to do much here at the front or over here on this side, just slightly like that. And that gives you an idea of how it goes. Then we can blow that off with the compressed air and make sure that there are no loose particles. And now we are going to put just a little bit of that zinc oxide paste in these 3 areas. Olivia's mixing it now for me. Just remember that we have to have some tooth marks here for the lower arch, because he's going to use his mandibular teeth to hold the bite fork against his upper teeth. Some people put cotton rolls under them, or some have their patients hold up with their thumbs in the mouth, but that isn't stable enough for us. We like to have the mandibular teeth holding it. And this is some of the co-nogenol. It doesn't take much, just a tiny little bit right here and here. And that will take any warpage out of it and make it more accurate. Now bite together. There. You may see it move just a little when you put that in, and that means that there was a slight rock in it. A little distortion. This way we'll take the distortion out. The mandibular teeth do not have to be in perfect centric relation. They should be in a retruded position, however. And he's using his lower jaw to support the bite fork while it's hardening. Could I have a paper towel? As I said before, this doesn't have to be any certain brand of zinc oxide paste. This particular brand, the co-nogenol, doesn't have any eugenol in it, so it doesn't burn the patient. Now, while he is sitting there like that, we're going to show you a totally new procedure, just like most of the things we're showing you today. We're taking the same face bow that we used for recording. We've taken off the graph supports, and we're going to show you how it's used in the normal sense. The Nasion relator is on the upside, or the superior side, when we do this. And we lock it right here to the crossbar. Now this is the slidable Nasion relator. We have the patient then grab the sidearms like this. Excuse me. We have one more thing yet to do. I forgot to put the bite fork assembly in here.
He doesn't do it all the time.
Bite fork assembly goes in this little hole right here, and it goes to the right side of the patient. This horizontal arm must go to the right. Don't have it over that way, but over this way, and you must be able to see the screw right there facing you at this point. Then you know that it's correct. If you turned it this way, you couldn't get to the screw to tighten. Tighten this set screw right here, and that will position the rod in a fixed relationship. This screw should be loose, and this screw here should be loose, so that this thing is totally loose and this clamp is loose. And then the patient should grab this sidearm right here, and I tell them to go slowly back toward their ears while I slide the clamp over the protruding end of the bite fork, right like that. Now the patient goes straight on back and puts it in the ears, completely, totally, all the way in, as far as you can get it, Bruce. Hold it in tight. Like that. Now at that point, the first thing to do is to tighten the big screw here. Patient still continues to hold it. All right, to get the vertical height now, up and down this way, remember the Nasion relator is loose, you bring it up until the Nasion relator is tight against the nose here, and push back here slightly like this, like I'm doing, and pull on the face bow with your fingers like this. That pulls the earpieces slightly forward. Don't hurt the patient, of course. And then tighten the screw right here. Now the patient continues to hold it. These are completely loose. This clamp is loose and this clamp is loose. Keep this horizontal bar here at right angles to the bite fork stem. And then grab the entire clamp like this, come in from the inferior surface like this, and hang onto that clamp and tighten it very, very tight, like that. All right, now the next one to tighten is this one. But don't tighten this one first. Always tighten this one and then this one, and it'll not put the pressure on the patient's head so much. Now we immediately release this one, pull the Nasion relator back like that, loosen this screw. The patient can pull it out of their ears. Open your mouth, Bruce, and we take it downward and forward away from the patient, like that. Now, the next step then, watch closely on this one, we release this screw right here, which is a little set screw, like this. We can take the face bow away and use it again, and we now have the bite fork like this. If you're going to mount on the arbitrary hinge, then you take this to the laboratory and put it into the little mounting fixture where the incisal table goes on the articulator and mount that way. But we're going to show you a new procedure here. We're going to put a crossbar onto this bar right here. This crossbar has a little set screw in the front, like this, that will set against a little flat. And you might be able to see the little flat right there. But anyway, all you have to do is tighten this. Now this is the orbital height. The end of this post right here, this vertical post, is the orbital height. That is, it's 7/8 of an inch below Nasion. All right, with that there, we can now put this back in the patient's mouth and have the patient bite on it again. There, bite down. Now we can take our sidearms, and to set them up for doing a transfer, a model transfer, we put the steel pins in, the axis locating pins, so that the beveled end is just protruding outside that brass shaft. If you look at it, you'll see that there's approximately, well, about 2 millimeters protruding. That's the beveled end of the axis pin, like that. And that's all you want. Then we can slide this back over the horizontal rod bring it up to this patient's skin like this, bring it up until it touches the patient's skin, and then we can lock it there like this with this screw right here. All right, just tighten this thumb screw first. We'll show you what we're doing. By tightening the thumb screw here on this, by the way, we often have the patients double up their fists like this, lean slightly forward like this, and support this thing somewhat like this. And that levels their head. There are two reasons I do this. Because there's a tendency for the patient to keep tipping their head back all the time while we're doing these transfers. But if you do this, and they double up their fists like this, it supports the bite fork, it also levels their head. Because we want that skin in a static relationship, just like it was when we put the mark on the skin. And this will repeat as closely as possible, because the only way you have of knowing where the axis of your joints are is through the skin. That's why you have to have a standard procedure where the skin is in its most static relationship. Nathologists have known this for many, many years, dating all the way back to Stewart and McCullum's time. These are the procedures that are standard in nathology. Now, I'm going to swing the patient around so you can see what it looks like from another view, and see how I adjust the sidearm here to the hinge point. What I'd like to have you do, Dr. Walker, is when I push this arm down like this, can you see the little point on the skin? Can you see the spot on the skin? So all I'm doing is just pushing this up, pulling this, adjusting it here, just by pushing it, until I come right to that point. There you can see it. It's right on. And then we'll do the other side. It's a little close. Okay, let me...
I just tighten this one.
Oh, you just tightened that one. Okay, we'll pull this one back a little bit. It's a little too close on this side. This point on this side is right on the tragus, so we have to back it up just a little. Okay, there we are. It's right there. Okay?
Yes. Great.
All right, we got it right on the spot on both sides now. And now what I do here is gently tighten this lock screw. That's very important. And you have to watch that you don't change the position of the clamp. And I didn't. We're right on the point. Right on the axis point. We'll do the same thing on this side with this little clamp, this little set screw right here. Now at that point, I take my fingers, I can release this point over there because I can repeat. I know where it is because the bevel is just protruding, and I can take this one and loosen it slightly like this so we won't scratch the patient. Open, please. And take this downward and forward away from the patient. Now immediately, would you help me hold it here just a minute? What I'm doing is pushing the steel pins back so the bevel is just protruding beyond that brass bushing, because that's the way we had it set up on the patient. Now, if you didn't want to do that, you can take your Bennett rings and you can push them in to measure the distance, and like this, and then you could come back like that, pull a steel pin out, and then push it back until your Bennett ring is touching the sidearm, and that would also indicate where the points were when they were on the skin. Now we can take this entire device over to the laboratory bench and do a hinge mounting on the articulator. Now, let's go to our mounting, and we have something new here also. It's called a mounting stand. What we'll do is take our face bowl, which was taken off of the patient like in this manner, and we're going to turn it over like this. And this is the maxillary frame of an articulator here. It's been put into this stand for convenience. And down here, you will see a line from this side of this mounting stand. Over here you'll see millimeter scale to measure the face width. So what I'm going to do is put the tip here and measure his face width. Can you see that on the screen? I think you'll have to show the whole thing there. Okay, there you go. So what I'm doing then, I'm putting it over here on the left side of this device and then measuring over there. Now you can't see me do this because I'm going to put it down like this when I do it to get an accurate reading. I'm also going to move this little device over to the side. This device is only for arbitrary hinge mounting. So it is over in this position when you're mounting on the true hinge axis. So now I'll do a real good job here of measuring the width of the patient's face. And straight down, and I am now getting about 150 millimeters. All right? These little calibrations here, these axis mounting shafts, are calibrated in millimeters, and there's a number on there that says 120. I don't know if you can see that in the screen or not, but there's a number that says 120. That means that when these are in, as close together as they can go, it's 120 millimeters from one axis point to the other. So I'll do that. I'll set them up so that they're exactly 120, like this. They're all the way in, and they're at 120. But this over here on the patient is 150. That means I've got to add another 30 millimeters. That means 15 millimeters more has to be added to this side and to this side. So I'll do that by reading these calibrations. So I go 5, 10, 15. Just pull them out to 15 millimeters and lock them. And I'll pull this one out to 15 millimeters. And I'll lock it like that. And now we should be very close to his face width. I'll come back here and see how close I came. And I came very, very close. Now it's okay to flex this just a little bit because the dimples in the ends of these axis pins are 1 millimeter deep. So you should have this 2 millimeters wider than the actual face so that you can engage these pointers here like this. I'll turn the face bowl back over to its normal position now, like this, and clip it in there. And now the little flexion that will be removed once it goes in, because I had this 2 millimeters wider than my actual points, and that will retain those pointers in the dimple. If you want to do this and you want to hook a rubber band out here or something like that, you can do that, but it isn't absolutely necessary. All right, the next step now is to put my paper and my retaining lug on. I probably should put this on first. Now this is the new split cast mounting plate system. Tighten that on. And these are called plaster dams. They're just strips of paper with some glue on the end. They're special papers. Nothing else will work, you understand. And paste it back on itself, and then we spray it like this. By the way, when we spray this, use any good lubricant like a silicone, and sorry about that. So hit it good like that, and then we can close this over here, and this must be a new one. It's got a lot of power in it. Spray this a little bit like that. And now when we put this back, you can just hinge it back over there. I'm going to now put a pad of quick setting plaster on there, and I need a large scoop because there's quite a space there. So Olivia knows about how much it takes, 2 big scoops, because we make a nice pad, a large pad there.
Well, earlier you said that if you tighten up those nuts on there, that there's enough rigidity in that mechanism to hold that, support that.
Here.
Yeah.
Yes.
Why are you making a patty of stone underneath it?
Well, I'll show you in a moment. I think it'll become evident what I'm doing. There's some value in this. Yes, you could mount this way, and you could close this over like that, but we found some other uses for plaster of Paris. Okay? And we just love this system here. I'll show you how it works. She made it very soft, which she should, and there are 3 little indentations there, and I heat this right up in the middle. This is curve number 2, quick set. We just pile it right in the middle. Don't spread it around, just heap it up right in the middle like that. And then I can close this over like this and just shake it a little bit like that. It will come right back into there, and I can move this out here if I want like that. Get rid of a little of it like that, and just let it sit there like that. When you're mounting on the hinge axis, you want to be as accurate as possible, even more accurate than the ear bowl, because you could be off the axis 5 millimeters with an arbitrary ear bowl. but we've taken the time to locate the kinematic axis, and so we don't want anything to flex at all. The screws might not come loose, but there might be some flexions that take place, and we want to not have any flexions at all. There's another reason why we do this, and I'll show you in a minute, the value of having that index. All right, now the plaster is hardened, and if you use quick setting plaster, it shouldn't take more than, 3 minutes, 4 minutes, or something like that. Now what we can do is dismantle this entire thing. I can pull this up like this, and it separates from that index. I can take the axis pins out like that, and I can remove this total assembly like this, leaving the bite fork attached to the stone, to the plaster, like this. So we don't have to have this paraphernalia. I can take it away, because sometimes it gets in the way. And let's say I don't have time to mount, or to go ahead, maybe my models aren't poured, maybe something else that I can set this on the shelf, and I can keep it for 5 years, and it's still accurate. I can come back at any time, set it in here like this, it will index itself, and I can put the patient's model on there and make a mounting. So that's a real nice advantage, because sometimes you find that you want to mount more than one maxillary cast. Now what it does do is that it dedicates this bite fork to this plaster, and you have to have more bite forks. In other words, until you get through with this setup and you know you don't want to do any more hinge axis mountings for that particular patient, you have to leave this bite fork embedded in the plaster. All right, so now we can put this model in here, and we notice it fits very well, and you can put all kinds of pressure on it now, and you don't have to worry about anything flexing. I can close the articulator over, and when I do, be sure this pin drops down, because that sets the vertical height. We look at it now and we say we're going to have a big scoop of quick setting plaster.
Ready?
Yep. So Olivia's going to get that for me. When it's in that mode, you have to have the leg back this way. Be sure you don't forget to bring this down and lock it when it comes over. That's important. First time you make a mistake, you won't do it again. I'll probably make a mistake later this afternoon to show you what not to do.
Did you do anything to the cast to make it retentive?
Yes, we have scored them around the edges. You should make retention on your cast. We've done that. I forgot to tell you that. Now, this is very soft, and that's the way it should be. And you put it in around that retention log, and then you fill a paper dam like this until it's level like that. Like this, and the rest of it, you just heap it right in the center of your model, like this. Just pile it up. Like that. And then we can close it over like this. Be sure you drop that pin down and push it right down into it. Yeah, it's locked. It's already done. Now, if you see some excess, which I have, I would take it off right now, because it will stick outside and protrude, shall I say, outside the perimeter of your model, and that's not too good. We're going to add another layer to make it look good pretty soon, but I'm just taking off any excess. There we go. Now just let that set for a few minutes like that. Everything is down, strong. All right, now what we can do here, now that we've mounted the upper model, we can take this off and we can remove our bite fork like this. We can take it out of here. We'll have to take it to the lab now and break it out here. And then we can pour some more plaster here, lubricate these, and make an index of these teeth down into this, and we can even use our bite fork again. All right, let me repeat that one more time. If we do not want to dedicate this bite fork for, say, several months or several weeks to mounting, we can now remove this bite fork right here, just pull it off, and lubricate the teeth, like put some silicone or Vaseline on the teeth, set this down in here, and with a very thin mix of plaster in here, we can close this articulator down over that plaster and make a permanent index for a remount jig for this upper cast. And then you can use your bite fork again. Okay, let's go ahead now and finish the mounting. But anyway, we have to keep this index. That's important. And that will index any future mountings of those casts to the articulator. And this is not an interchangeable articulator frame, so that you can move these models right from this, go directly to your articulator for doing the mounting of your mandibular cast, which we will do next. Now, if you watch me, when I loosen the screw, watch how I remove. Did you see how that's separated? Absolutely clean, like this. So you don't have to beat and scrape your mounting plates anymore. They're self-cleaning. Now keep the paper on there. Yes, sure. How many of you like to clean mounting plates? It damages them. So we'll just take and brush off any little loose particles that might get on there, and we can seat this right back. But keep your paper dam on. And now Olivia is going to mix another layer of soft plaster. She's going to take her spatula and she's going to use this as a guide and the buccal vestibule as a guide and get a nice smooth finish on there. And then we will mount our mandibular cast.